This is a final exam review for HKIN 226, Focus on Personal Health at St. Francis Xavier University. This is meant to be review and not instructional. I'll highlight some main points that we discussed in the second half of the course, but you'll have a lot more information in your notes. So I recommend that you go and look at your notes, and then if you have questions, feel free to email me anytime before the final exam to ask those questions. Now, the first section that we discussed in the second half of the course was relationships. What are the successful traits of a relationship? How do we navigate relationships? What are the ultimate goals of relationships? And we identified that it's pretty important to understand your self-concept. This is what you bring to a relationship. This is what has to fit in with someone else's self-concept. And you have to help them understand how these two are going to fit together. You have to have a clear definition of your self-concept in order to articulate that to your partner. You also have to navigate the external pressures of society, your past history with your parents, with other individuals that you've been in relationships with, and knowing that, really having an authentic view of your self-concept, your person story, is important in developing a successful intimate relationship. We highlighted that relationships change over time. They start with a passionate infatuation and they turn into something that's more enduring, that's based on common interests, on projects, on family, children, and that switch can be interpreted as a crisis. Whether it is a crisis or not, or whether it stays a crisis or not, depends on whether you can communicate that self-concept to your partner, whether you can tell them what your expectations are, whether you can discuss what the future holds for both of you. Now, stress in a relationship doesn't just happen at that one point to cause this transition. It happens all the time. Stress happens whenever there is a conflicting view on an issue. This could be as simple as doing the dishes to as fundamental as who's more attracted to the other person. And in any case, being open and honest is always the best policy. You have to be aware of how the person will interpret what you're saying. You have to know their person's story, their self-concept, in order to relay the information at hand to them appropriately. And you have to know what it is that you want to relay. You have to know what your expectations are for this challenge, for your relationship in general, moving forward. Overall, unrealistic expectations are at the core of these challenges, I think. And two main ones that we identified in class are getting into a relationship and expecting your partner to change eventually to fit your ideal. That's unrealistic. Or getting into a relationship and hoping that you will be fulfilled by your partner. You have to end up taking ownership. You have to be respectful of your partner's wants and needs and know that your expectations might not be realistic in some scenarios. If you've been able to identify realistic expectations but you're still facing many challenges, then ending an unhealthy relationship might be the right course. It's easy to synthesize 5 bullet points here. It's a lot more difficult in person or in practice, but if you've decided that a relationship is unhealthy, if you're not getting the reciprocity that you need from the person or the openness, the honesty, then you have to be able to give the relationship a fair chance. You have to be open and honest in your communication here as well. Be compassionate. Don't be hurtful. And know that recovery won't be immediate. This is akin to planning for relapse in your habit change assignment. Know that you'll experience anger and pain, and then learn from that what you're looking for in a person, what you yourself are looking for. Assess your needs, look ahead, and move on. The ultimate goal of relationships has changed in recent years with an increasing number of people pursuing singlehood. It could be that there are more there's a higher rate of divorce, and so there are by definition more single people, or individuals are seeing this and realizing that committed marriage might not be for them. And there are certain advantages and disadvantages to this, but whether you're successful or not at being single generally depends on whether it's a conscious choice, whether you have a support network, friends, family that you can be social with and engage with, whether you have a standard of living that you're comfortable with. Is your job fulfilling? Does it allow you to live the lifestyle that you want to? Do you have goals and projects, interests, etc. that can take up your time that you can focus on? And then also, are you comfortable with being alone? Because for a lot of people, they're not comfortable with being alone. And if it boils down to simply you're not comfortable in that situation, then singlehood might not be the right path for you. But of course, you have to balance this with expecting fulfillment from your partner. Be cautious there. On the other end of the spectrum, marriage is a successful, or ideally a successful relationship to the nth degree. Commitment here is absolutely key. It defines a marriage. Marriage requires more openness and honesty than any other relationship because the extreme challenges that you experience with a marriage will always be there. Finances, disagreeing about marital roles, or dealing with extended family. These are all things that will have to be navigated, and will have to be navigated skillfully by communicating with your partner. Now, what really helps here is the idea of commitment. Not only does it provide the foundation to become married, but it's a reminder for growth and to invest effort throughout your marriage. You remember why it is that you decided to spend the rest of your life with this person. For some people, but not for all people, marriage ends up resulting in having children. And there are different ways that you can raise your children. This isn't an instruction on how to raise your children, but the type of person that you are generally will inform how your style of raising children. The two main characteristics, demandingness and responsiveness, describe whether you are nurturing or describe whether you're overbearing. And the combination of these two will dictate what style of parent you are. Now, some of these are more successful than others. Some of these might cater better to the child that you have because they're going to have their own personality. And I'll encourage you to go back and review those on your own time. Next, we talked about drugs and alcohol. These are different types of challenges, but some that all individuals will probably deal with at some point in their life. The big concern here is addiction and harm from using these substances. We contrasted what we mean by addiction versus habituation, the big difference being the compulsion and the physical dependence on a substance. That characterizes drug addiction, and that's what we want to avoid if at all possible. That's where we see a lot of the harm to society and the individual. But if we look at alcohol, the status quo can be interpreted as promising. We notice that virtually everybody has used alcohol or consumed alcohol at some point in their life. That's to be expected. It's a legal substance. It's a large part, an ingrained part of our culture. And so it's not unreasonable to think or to find that a lot of people use alcohol. What is encouraging, I suppose, is that few people, relatively, exceed the guidelines. Exceeding the guidelines here means abusing alcohol. Few people exceed the guidelines, but of those that do, the ones that tend to do it the most are the 20 to 24-year-old cohort. So this is important to know because it would help us focus our efforts if we were ever to direct information or try to help individuals. It helps us identify who might be at the greatest risk of substance abuse problems, alcohol abuse, or harm to themselves and society. Ultimately, with this section, I really wanted to look at whether binge drinking was bad. We watched this BBC Horizon video of the same name, that tried to compare, or that did compare, the pattern of drinking. Binge drinking versus methodical, we'll call it responsible drinking in quotes. Is binge drinking really that bad? We found some conclusions from this video that are listed here. There are others. The story is a lot more colorful, a lot more involved. I'd recommend that you go back and watch that video. But some of the main summaries are included here. We found that regardless of the pattern of drinking, alcohol consumption is hard on the heart. It beats faster and seems to have a harder time when drinking alcohol. We looked at why hangovers happen. The video suggests that this compound called acetaldehyde might be partly, if not fully, responsible. This is produced when we overwhelm the systems that process alcohol and metabolize it to get rid of it in the body. We found that dehydration isn't as much of a problem as we might have thought. These guys, when they monitored and kept their fluid intake consistent, ended up losing the same amount of fluid, indicating that whole body water loss is not really a problem. Now, where we did see differences is in this idea of inflammation. We observed systemic inflammation regardless of the pattern, but the main difference was that gut bacteria got into the circulation after a binge. Now, this shouldn't happen. We want to keep our gut bacteria separate. We want it contained in the gut. And we don't know what the ramifications of this are, but we imagine that they're not positive. It's probably not a good thing to have gut bacteria swimming around in your bloodstream. This is reminiscent of mild sepsis, which is a fairly serious life-threatening disease. So we don't know what the long-term effects of this are, but binge drinking is pretty bad for you. Both are really bad for you, but binge drinking, 21 units in one night, causes some pretty severe challenges to your system. We don't know if this will be the same with 14 units a week. We don't know if or how much time is needed to recover successfully between binges. There's a lot more work to be done here, but it's safe to say that both are pretty bad. When it comes to drug use, marijuana is probably the most recreationally used drug. Here, if we compare it to the stats on alcohol, relatively few individuals have used cannabis in the last 12 months, and that's good. And this number is significantly lower for harder recreational drugs like cocaine or hallucinogens. Again, we see that the 20 to 24-year-old age group is most likely to use marijuana, but the group most likely to inflict personal or societal harm are younger individuals that might not be as experienced with these substances. So the status quo here is, again, pretty promising. Low rates of use, low rates of harm. It could be that prohibition is making these substances harder to obtain, or it could just be that this is the natural trend. We're not too sure yet. Short-term side effects are lack of coordination, disorientation, etc. We observed that marijuana use will double the risk of motor vehicle accidents. The risk of motor vehicle accidents, but in practice we saw in Colorado after legalization no practical change in the incidents or deaths stemming from motor vehicle accidents. And otherwise, the physical effects are few and far between. We did see a decrease in sperm count in young men that have used marijuana in the last year. That's accentuated when using harder drugs and smoking as well. But generally this is reversible, but we don't know how long it takes to reverse. So this might be a consideration for young men if they're in a successful relationship and considering having children. Long-term side effects are more centered around the emotional aspects, emotional issues. Long-term, we found that marijuana can be addictive. It's popular to think that it's not addictive, but if we compare it to addiction rates for other substances, it's lower, but it's comparable. In adolescence, marijuana is as addictive as alcohol is. It's not as addictive as nicotine or heroin, so that's good news, but it is still somewhat addictive. So it's not correct to say that it's not an addictive substance. it does tend to accentuate any existing conditions related to anxiety or depression. Any psychotic illness might be stimulated by marijuana use. We're still learning about the effects here, but we saw in one study an increase in first-time onset psychosis with heavy marijuana use. It's not to say that marijuana use would cause psychosis, but perhaps those individuals are inclined to search out marijuana. Maybe it's an escape for them, maybe it's self-therapy, we're not sure. The same thing goes with the fact that it's related to lower academic performance or socioeconomic status. Is it causing these things? Maybe, maybe not. It could be that individuals in these scenarios are using marijuana perhaps as an escape. We did discuss briefly, and there's very limited research here on the withdrawal symptoms of marijuana. Being an addictive substance, there are withdrawal symptoms. Our best guess now is that these center around anxiety and dysphoria, a general disengagement from the pleasures of daily life. So if you're an individual, or you know an individual that tends to lean towards any of these characteristics, then marijuana use is probably something to actively avoid in those situations. One tangible long-term effect that we saw, though, that's perhaps a little bit scary, is this decrease in IQ with early initiation. So regardless of usage later in life, at 38 years old, when you were initiated early to frequent marijuana use, that's 4 days a week in the 13 to 18-year-old range, we observe this persistent decline in IQ. And it's regardless of whether you continued to use marijuana later on into life. Something about the developing brain being exposed to this frequent marijuana use early impaired IQ. We don't know what that means for success in a job or success in a relationship or these less tangible outcomes. How does it affect motivation or your ability to be a person? We don't know, but it seems to impair IQ, and that in itself is a bad thing. We don't want IQ impairments, simply put. Now, interestingly, on the right-hand panel, we saw that regardless of use at 38, if you were initiated later, after the brain had mostly developed, then there wasn't this effect on IQ. So it's really something about the exposure of the developing brain to marijuana that really signals caution here, that requires or warrants future research. This is definitely an area that we want to focus on to prevent too much usage. So this is the end of our very brief overview. There's a lot more information that we haven't discussed and in a lot more detail, so I'd recommend that you guys go back and look through the notes, but these are a few areas that I wanted to highlight as important areas to study for the final exam. So as you're looking through your material, if you have any questions, as always, feel free to email me. Let me know if you have any issues, and even set up a time to stop by and we can discuss in person. Otherwise, best of luck studying, and I will see you at the exam.